I was playing basketball and tennis, and I was just short of breath, and I just thought that I was really unfit. And it actually felt like I had food or something stuck in my throat, and I can remember running down the court and punching myself in the chest, trying to dislodge what I thought was stuck in my throat.
Every morning about 10 o'clock, I used to feel like I hadn't been to bed. I used to feel really, really tired, and I'd get quite sleepy.
The cardinal symptoms would be chest pain. So particularly if it's sort of a dull pain that radiates down your left arm, up into your jaw. I mean, that's the classic symptom. And I mean, if you get that, that's pretty typical of heart disease.
This one particular day I was playing basketball, and in the opening minute or two of the game I couldn't breathe. So I stopped playing and I went and sat on the bench, and then my jaw started aching quite badly, and it was like a pain in your back teeth, and it wouldn't go away.
The other symptom that people often get is breathlessness, and I guess that's the other thing, particularly if you get breathlessness when you go for a walk and you start to get more and more breathless. That can be a sign that the heart's struggling for oxygen. So you may need to get the things checked out from that point of view. The third one is palpitations. So if your heart starts to go out of rhythm, that can suggest there's some sort of electrical problem with your heart. The fourth one would be dizziness, which can be a sign of a drop in blood pressure, or perhaps a high blood pressure. And the fifth one would be swelling of your ankles, which a lot of people get, and can be due to either high blood pressure or a heart problem.
Basically, it was the fluid in my body all rising up and compressing to my heart and pushing my heart up, virtually giving me a heart attack. I think I had a heart attack.
Well, what actually happens in a heart attack is that their arteries that supply the blood to the heart muscle actually run on the outside of the heart like little rivers. And one of those arteries blocks up. The actual process of lack of blood flow to the muscle causes the heart attack. Now, the reason that the arteries block up is that little plaques or little bits of cholesterol form on the inside of the arteries. And when one of those plaques ruptures, the cholesterol plaque actually forms a blood clot on top. And when that artery blocks off, that causes a heart attack. So controlling the cholesterol build-up in the arteries with medication and thinning the blood down with aspirin or a similar type of drug prevents heart attack in many people. And when the heart attacks do occur, they tend to be smaller heart attacks if you're taking those medications. So there is a good incentive to stay on these tablets if you have plaques in your arteries.
Once where they've decided that there could be a cardiac issue there, they will be done a lot of testing. So some of these testings can be things such as exercise stress tests, where you go on a walker and the speed and also the inclination also increase in incremental times. And sometimes this can make some changes to their heart rhythm and shows that the heart is actually under stress. But some of these tests can they're not exactly definitive, so then there may be other tests that patients have to go and have, such as an angiogram or a CT scan or other things that the patients can go and do. So once that decision's made that people may go down the line for a coronary angiogram, then there's a preparation for that.
This is the cardiac catheter lab. This is where you'll come if you need to have a coronary angiogram, and this is where you'll come to find out if your arteries have any serious problems that might need surgery or a stent. When you have the angiogram, a small amount of local anaesthetic will be placed in your groin and sometimes in the wrist if the doctor decides to go through the wrist, but more often the groin artery is used. And a small plastic tube will be inserted into your groin and up through the artery and passed up the blood vessel in your body to the heart. And through that, a small amount of dye will be injected, and we get a picture similar to this picture on the screen of your coronary arteries. And that really is the roadmap to tell us if you have a major problem or not. There will be a little bit of discomfort in the groin or the wrist when the tube goes in, but local anaesthetic is used beforehand, and sometimes some intravenous sedation may be needed as well. If your arteries are fine, then we'll all be reassured and we can all go home happy. If we find a problem, I'll be on the phone to one of the heart surgeons, and you'll see someone within a few hours usually if there's a serious problem. So the cardiologist will know pretty much straight away, as soon as the pictures are taken, whether you in fact have a problem with your arteries that require therapy.
If you have any symptoms that you're not quite sure about, it is always advisable to ring 000. The ambulance number, the ambulance would much prefer you to see you with a false alarm than you not actually get to hospital in time and the damage is already being done to your heart.
Time is muscle, so the longer you delay, the more likely you'll have permanent damage to your heart muscle. So if you come in within an hour, usually you have a good prognosis and sometimes there'll be no long-term damage at all. But if you come in for more 6 or 12 hours later, sometimes there's little chance of the heart muscle recovering. So there's a window we have in cardiology where as soon as you have the onset of the blocked artery, the clock starts ticking. And the longer you leave it, the more muscle damage there is. And unfortunately, we can't repair damaged muscle at the present time. I mean, there's new research being done, but essentially the stem cell research is not quite at the stage where we can repair damaged heart muscle. So if your symptoms sound like a heart attack, call the ambulance and get straight to a hospital.